So today I have a 21-year-old male who had sports injury and he had a nasal fracture. Now nasal fractures we always assume are bony, but sometimes they're not bony. It's not about the bone alone. And you have to look very carefully where it might be cartilaginous. In this case it seems cartilaginous, and it seems to me that the upper lateral cartilage collapsed. Once it collapses, it's hard to get that back up. You really can't rely on it. So what you can do is you can try to push it back up and support it one way or the other, or you can graft it to fill the depression that's happening on the left side, as I'll show you. So we'll take a cartilage graft from the ear, place it there, and then match both sides so we get symmetry and a relatively straight nose. So let's get started. So we have this wonderful 21-year-old male who had trauma, sports related, and he had nasal fracture. Now if you look very closely, I'll show you, like if I cover this area, this looks pretty straight. As we go down, it starts moving. So this is the rhinion right there. So this is where the cartilage starts. This seems pretty good, but right from here to here, and that's most likely because the upper lateral cartilage right here is fractured and collapsed. And trying to get the cartilage back up is impossible. It's not like the bone where you just push it over and works. So what we have to do is put a cartilaginous graft here to build up the cilia to match this side, and then the nose will look relatively straight. So that's what we'll do. We'll get the exact measurements, get the graft, and get to work. So we want to keep this handsome man continuing to look handsome. Okay, so here we are. I want to show you the marking. Would you come in over here, please? And if you get a close up, you'll see that I defined midline, and then I defined right here. Rachel, can you see on this side? Or you have to, this side right there. So this is the depression right there. And I measured 12 millimeter, 12, 12, and 8. So now I have to, once I get this up, it's going to match this area right there. For this, we are harvesting right here from the triangular fossa. So you can see I've marked it in there, inside. It's 12, inside 12, right there, all the way in. And this is 8. So we are going to make our incision along right here, the concha. Lift it up, remove it, and we're good to go. Thank you, we'll show you soon. There we are. Good. Keep it going, because I'm gonna put it on the nose now to show exactly how it's gonna go. Right there. Okay, so here we go. We have the morselizing done, and you can see that's really nice and soft. There we go. And that's what you want. I don't need a lot of strength in there. I'm not doing it because of a valve collapse or something. So just enough, nice and soft. And I like to say, as you know, my mentor, Dr. Pastoric, says, like a wet cornflakes. Like a wet cornflakes. That's what he says. So I like that analogy. So here we go. That's where we're going to go. And now let's get my devil hook. So the first thing I'll do is I'm going to suction the cavity a little bit, make sure that everything is okay. Good. Now I'm going to use the scissors to make sure I have enough access. Yep, I have enough access. And now I'm going to take the bold step. Can I have the brown eggs, please? Now I'm going to take the bold step of putting this in there. Let's do this. Okay, there we go. You have to be careful that it doesn't fold on itself. So that's the pain in the neck. And the trick is to just get a leading edge, and there we go. Now I'm going to need some Q-tips, please. I'm going to suction through the gall so that we don't end up sucking it out. We won't. Very good, very good. So now I can make sure that we have it right there. Good. Fantastic. So we have it built. Good. Thank you. So I'm very excited to show you the final result. It's not final, there's still some swelling, but you can see the nose looks straight. Now, normally when we think of nasal fracture, we think of nasal bone fracture. And in this case, we did not touch the bone and the nose looks straight. So it is very important for especially the new surgeons or residents to realize it might not be a nasal bone fracture, might be a collapse of the upper lateral cartilage. And in that case, you can correct it by a graft. And that's exactly what we did. So we took the graft, as you remember from the video, from the right ear, and you can see it's healing really well. There's no deformity, and triangular fossa worked very well. I like triangular fossa more than the concha when I don't want an extreme curve. Triangular fossa does not have as much of a curvature and convexity, so it's easy to manipulate and soften and morselize and put in there than the actual concha. And usually there's plenty of cartilage for a small area, and that's what we did. So you can see that is the trick. And we'll do a 3-month follow-up photograph as well to show you the final result. And any residents who might have questions, feel free to reach me through my office, email, phone, whatever you want. I would love to answer any questions for you. The surgical ENT residents. Thank you.